I'm Logan Crawford, and right now on Spotlight, it's a holiday weekend, or it's the middle of the night, and you're not feeling well. You don't need a hospital, but you do need medical advice fast. What do? Well, there's an app for that. It's called Aloteb, the most convenient way of getting a doctor's consultation right at your home. And we're delighted to have the man behind Aloteb as our guest today here on Spotlight, Mohammad Fouad Al Jamal. Mohammad, thank you so much for joining me here today.
Thank you for having me, Logan, and thank you for the fantastic introduction. That was
My
really impressive.
pleasure. I am very enthusiastic about this app because I think it's needed. It fills a void in people's medical care. Tell the folks at home basically what Aloteb is all about.
For sure. I'd like to start with the name because I think the name is not going to be like a generic name. Aloteb, alo in slang Arabic, it's the traditional way of saying hello. So usually people, when they answer the phone, they say alo instead of hello. And tib in Arabic means medicine. So basically, Aloteb is hello medicine. Aloteb is a startup based here in the United Arab Emirates. It was co-founded by myself and Dr. Mohammad Abdel. He's a licensed physician in a specialty in dermatology. Aloteb is a telemedicine. It's a telemedicine tech company with the main aim of providing reliable and
accessible, right? That's
accessible,
a big part of it. Accessible medical care for
accessible,
people at
yes,
home.
an accessible medical how do you say it? Medical consultation with no hassle and to be straight to the point.
Yeah, absolutely. And it's available on the App Store on Apple. It's also available on Google Play. You can download it. And it seems like it's a very user-friendly app.
Correct. Aloteb is a very user-friendly. That's one of the main advantages and the perks we've been working on it for the past 2 years. And through the easiness of accessibility for it and how user-friendly it is, actually, Aloteb is it is the only licensed and certified telemedicine multi-specialty application here in the United Arab Emirates. It got licensed by the Department of Health. We're providing 30 plus medical specialties on the app itself. The main aim of Aloteb is to provide an inclusive turnkey solution to the health industry. So basically, we're trying to provide the industry with the solution for what we feel there's a gap in the market in it.
Absolutely. And it also integrates with other health apps, which is important.
Correct,
so
yes.
The doctor, when he's talking to you via your phone, can actually see your data to see what your latest echocardiogram looked like, what your latest EKG looked like, might have a detailed report on your CT scan. That's vital.
Correct. The Aloteb app, I think the potential is astronomical. Like the Aloteb app, like if we get started, I think the sky is the limit. Aloteb basically can be integrated with the majority of the apps diagnostic tools that are used in the market right now, from the Apple Health to the Android Health watches and so on. I think the IT department will be more knowledgeable on discussing the technicalities of it. But with coding and everything, it's going to be an easy process for it to be used. Actually, one of the main focuses of Aloteb that we're focusing on as well is we're trying to integrate portable, diagnostic tools and artificial intelligence in the app as well. So basically, we just don't want to be known as the application that's just going to provide medical consultation, because there's plenty of apps in the market right now that are providing medical consultation, and that's it. We're trying to provide this turnkey solution, like an all-inclusive solution. Like you can get your consultation, you can get your diagnosis, you can basically get your prescription, because the app as well will be able to include insurance. That's the potential as well, to have insurance, and you can pay it as cash as well. So we try to provide. So basically, the minute you're feeling sick, you're feeling drowsy, you have certain concerns, you can connect with the app. we're trying to target around 15 minutes that you have a medical professional to be able to answer your call, get your diagnosis, get you your prescription, and through stakeholders and partners that we're trying to partner with as well, with pharmacies and everything, to be able to provide you the medication as well. And we're targeting for this process to be between 45 to an hour, depending on the location as well.
Amazing, amazing. The integration of the app is great. People will be able to talk to the doctor, one of 30 specialties online, which is quite amazing, and then actually get the prescription there on their phone, sent directly to the pharmacist. It's really a game changer.
Exactly, Logan. The beauty of it, just imagine at the palm of your hand, you'll have access to medical professionals, pharmacists, radiologists, laboratories, and so on. So with the touch of a button. So this is the beauty of technology right now.
Exactly. And as you said, as the integration gets even greater, I know my watch right now will give me an ECG. It
Correct.
monitors my heart rhythm. It tells me my heart rate. It tells me
And it
my body
notifies you
temperature.
if your heart rate is increased, decreased, and gives you push notifications to provide you, and all of that can be integrated and provided as well in the application.
Exactly. If I have a reading of AFib, now I can share that with the doctor immediately, and he or she can take a look at it and say, this is a normal pattern for you. This is something that needs to be seen. This will need more follow-up testing. So like you said, the potential is limitless.
Correct. The potential is limitless. And, with my engineering background as well, we focused on the sustainability aspect of it, because if you think about it, taking the environment into consideration, telemedication goes hands in hand with sustainable measures. A lot of the governments right now, I know the Department of Health here in the United Arab Emirates are pushing, because they have like set goals. Like, for example, here in UAE, I'm sure other countries as well are focusing on sustainability, maintaining the environment, having a better future for everybody. And the Department of Health here right now has a goal by 2030 to drop their carbon emission by 20%, and they have zero emission by 2050. So that's their goal. And I think that Aloteb and telemedicine and telehealth as well will go hand in hand in doing that, because you just can imagine how much of time is wasted waiting in line in hospitals, driving there. It's all things that affect the environment. We will need less facilities as well, because it's going to provide. Aloteb's potential is so vast that I believe that it doesn't just it affects the whole health industry. It doesn't just affect the patients as well, because if you think about it, Aloteb can be integrated into like hospitals, into even governments as well, because we can provide perfect, or I wouldn't say perfect, because perfection is very hard to achieve. I would say that we provide reliable, up to the bar, with top of the line policies and codes to people who need it in the rural areas that they don't have access to medication. It can be a vital tool, because if certain areas or certain countries with lower income as well, that they need some specific specialist that is not available there. Telemedicine can bridge this gap between the doctor, the patient, and it can, with Aloteb, with the diagnostic tools, with the integration of the video call and the straight to the point interaction between, because it's all encrypted. It's a two-way encryption system, so everything is confidential as well. So every information used on Aloteb is secured.
Absolutely, absolutely. Yeah, it's an amazing advance, that's for sure. You're based right now in UAE, the United Arab Emirates,
correct,
but this app is actually available around the globe right now, correct?
Correct. The application, the United Arab Emirates is the startup. They provided all the facilities for us and the services for us to start up because we had the concerns of which one is the best place for us to do. And with the facilities provided here in the United Arab Emirates, we felt that this is the best place for us to be able to freely push with the licensing and everything, because the Department of Health was majorly expedited the whole process, because a lot of the things that the policies that we're trying to implement we're kind of the pioneers in certain criteria, because we're trying to push the limit of what's known for like telemedicine and telecommunication and telehealth. We're trying to do in a lot of, you have to go and jump through a lot of hoops when it comes to like cybersecurity and what kind of this one. So we're trying to interact with top of the line companies, like telecommunications provided by Zoom, AWS is providing the server protection and so on. So what we're trying to do is we're trying to push the limit and create policies and to provide patients with honestly reliable medical consultation from certified and licensed medical professionals.
Absolutely. Well, you were doing that. You were succeeding. Even if you need a note for your employer or for school, Aloteb can provide that as well. And think back to just a year or two ago, nobody wanted to go to the doctor's office because you were afraid of what you'd be exposed to. Now,
Correct.
at the convenience of your telephone, in the comfort of your own home, you can get in touch with a doctor, one of 30 specialists who can help you, who can have access to your health records because of the integrated apps that work with Aloteb. This is a game changer when it comes to modern medicine and how it's practiced. Mohammad Fouad Al Jamal, thank you so much for joining us here today on Spotlight.
Thank you so much for having me. All
My
the best.
pleasure. And to the folks at home, I'm Logan Crawford, thanking you for your time this time. Until next time on Spotlight.